I'm Jodi Brenner Ginsberg of Ginsberg Law Offices. Today I would like to speak to you about failed back syndrome. Basically what that is, for many of you who've had bad back injuries, who perhaps have undergone one surgery on your lumbar spine or thoracic spine, or perhaps two. In essence, it is what it is. It's failed. Your back has not gotten any better, and that could be due to complications from your injury, complications from your surgery. Ultimately, you have not healed well. And it's a very unfortunate situation. We see a lot of that in our practice. Many of my clients have sustained significant back injuries, whether they've herniated their discs at various levels of the lumbar spine or thoracic spine, and certainly in the neck as well. But basically what happens is the treatment starts out with a typical back injury. You would see your doctor. He or she might offer you physical therapy and rest. From there, you would probably get injections in your spine if, in fact, the doctors felt that was going to be something that could potentially help you. Usually that's called an epidural steroid injection, and what that is just putting some medication in your body, in your spine, so it can try to heal itself. Unfortunately, in many cases, when there's a disc injury that's significant, specifically a herniation or a protrusion that's touching the spinal cord, those injections don't always help. After you've undergone one or two of those, the next step potentially could be back surgery. That could be anything from a lumbar discectomy, where they're cleaning up the disc, to a hemolaminectomy or a microdiscectomy as a lesser invasive procedure. And ultimately, you find yourself in many cases with a significant back injury having a fusion surgery. With fusion surgeries, you're dealing with one or two levels. Sometimes they might even deal with a third level, but that really is a rarity. Most doctors do not like to fuse three levels. After that surgery occurs, or even before, the ability to heal sometimes is diminished. Again, I'm not here to give you medical advice. That would come from your doctor. But what we are dealing with and representing you in these significant back injuries are situations where your back pain does not get any better, or perhaps your leg pain gets better but your back pain does not, or the vice versa. But ultimately your doctor is telling you that after undergoing one or even two surgeries, there's not much of a chance to do healing, and you continue to have to live with this kind of pain. From a legal perspective, this allows us to talk about future TTD benefits for you, potentially getting a catastrophic designation, which goes beyond the 400 weeks that in many cases a case will be limited to. It talks about some specialized medical care which could continue on with pain management, just being able to manage your pain through more injections, medications, sometimes a spinal cord stimulator. These are very complicated cases, and you do need professional help and guidance through them. We're more than happy to help you, and you can reach me directly at 770-351-0801.